Hello everyone, welcome back to this next video. We are going to be looking today at a technique that I have learnt through Jill Miller. I went on her Body by Breath masterclass recently, and I'd also been following this technique for a little while, give it to a lot of my patients. It's absolutely divine. It's called a lumbar hammock and a thoracic hammock. So remember, lumbar area is down here, thoracic area here. What you will need for this is 2 balls. I've got her gorgeous balls here, but if you don't have Jill's equipment, your little stability Pilates balls will do a really good job as well. Ideally as well, when you do this, you want this next to your skin. For the reason, like I've said before, that these balls are quite tacky, so they actually pick up your skin and stretch it nicely. For the sake of today, I'm going to stay covered because I don't think you need to see my abdomen and rib cage. So what are we going to be doing here? Well, we're going to create a hammock position. We're going to have the 2 balls placed here on the body. This will be our lumbar position, and then our next one up will be thorax. So as we come into this position, I'll then talk to you a little bit more. I also have here a yoga block. You might want to rest your head on something, so that's why I've got that handy. So you will have balls against skin. They're about 70–80% inflated, they're not full. So we're going to pop it between low back, lie down on our back, maybe bending knees. So at the moment, what you want to feel is that the balls support your spine. Your spine's not resting on the floor, it's hovering. But you want to feel like you have a sense of even support and even traction. And as you start to rest into this position here, you should start to feel the weight of your body slowly sinking in. And you're going to feel a really nice spread wide of your thoracodorsal fascia, your skin, the connections up towards your diaphragm as well, your lateral raphe within the fascial system. So as we rest here, we're just going to focus on slowing our breath down as well. So these techniques are really, really good for calming your system, focusing and tapping into your parasympathetic nervous system, which is your fight, flight, and fight, flight, and heal. It isn't at all. Sorry, guys. Parasympathetic nervous system is rest, digest, and heal. That's the one we want to be into. Taking ourselves out of our fight, flight, and freeze system, which is where we end up living for the majority of the day, especially in this day and age. So maybe just focus on taking some breaths into your belly here. And then as you exhale, really surrendering in. Now when you're doing this yourself at home, you can be here for 5–10 minutes and really feel the weight of your body. You might need to readjust the balls a little bit. Some little additions that you can have here might be to add in some little pelvic tilts in sagittal plane, so forwards and backwards pelvic tilts. You might want to do your side to side pelvic tilts. So that's shortening one waist and then the other. You might even quite like a little roll of the legs. And you want to really feel that this is gliding and sliding fascial tissue at the back of your body. So it's a really nice decompress as well after the end of the day, especially if you've been dancing all day. We're then going to come and just demo thoracic hammock. So the balls just come up higher. They're now on either side of my rib cage. And again, might just take you a little while to adjust into this. So now my rib cage is suspended. I'm not quite leaning on the floor. The 2 balls here are really tractioning my tissue here and allowing my rib cage to drop. And the focus we're going to do here, this is a nice yogic breathing exercise, and Jill also does this in her program. We're going to just start off breathing, feeling the back of the ribs press into the balls. So this is encouraging expansion at the back of the body. You might want to breathe into more onto one side than the other, or use it as an investigation, self-assessment. We're going to do a diaphragmatic stretch. So we're going to take a belly breath in, spread it into our low rib cage. Then you breathe out. As far as you can, all the air expels from your body. Then we're going to activate and widen our rib cage, but not take a breath in. So contract with your muscles, really spread your rib cage wide. You'll actually get a sucking and hollowing motion in the tummy. And then let everything go and do a normal breath. So what we have again, if I just come into sitting to show you, we breathe in belly, side ribs, exhale everything, and then contract and pull side ribs wide. This is going to really contract the diaphragm, give it a good stretch as well. And then we relax everything, and you'll feel this scoop and hollow within your actual belly area. Now, obviously, this is just a demo. You will spend a lot more time in these positions, but we can as well, in this position, once again, drive from downstream. So you might want to add on pelvic movements. You might want to draw a knee up, which will also create tension into one side more than the other. You might want to move your arms around, squidging high here, rotating them. So just really allowing decompression within the rib cage here. And notoriously, as dancers, we're extended here all the time. So this is a really nice decompression to do at the end of your day. Remember, this is a quick demo, so you would want to spend a really nice decent amount of time deeply breathing, extending into your body. I hope you enjoy this. It's a really beautiful exercise, helps bring you into your healing and calming state. And I give this out to quite a lot of my patients now. So thanks, Jill.